Hi my dear friends, in this video I am going to tell you various nerve fibers which forms our parasympathetic nervous system, and its short form, that is PSNS, that is parasympathetic nervous system, is very commonly used, and this topic is very important for your PG entrance examination. So friends, let's begin. So which nerve fibers forms our parasympathetic nervous system? So this is craniosacral outflow. So what craniosacral outflow? It means our parasympathetic nervous system is formed mainly by the cranial nerves and by the sacral spinal nerves. Now here question comes, which cranial nerves? So these are third, 7, 9 and 10. These four cranial nerves, one is oculomotor, second one is facial nerve, then glossopharyngeal and vagus nerve. So these are the four cranial nerves which forms our parasympathetic nervous system. Now which are the sacral spinal nerves which forms our parasympathetic nervous system? So these are S2, S3 and S4. So again my dear friends, cranial nerves are 3, 7, 9, 10, 3, 7, 9, 10, 3, 7, 9, 10. One is oculomotor, second is facial nerve, ninth one is glossopharyngeal and 10th one, as you all know, a vagus nerve. And the sacral nerves include S2, S3 and S4. So if this is our central nervous system, in which this is the brain stem and this is the spinal cord. So from the brain stem, cranial nerves emerges, and in the below portion, the lowest portion of the spinal cord is the sacral part, So this is cranial part in the brain stem and sacral part in the lowest part of the spinal cord. So these are present on the periphery. And in the central part there is thorax and lumbar region. So the thorax and lumbar region that are present in the central part forms the sympathetic nervous system, while the peripheral part forms the peripheral includes the cranial and sacral. So these are the peripheral part, and these peripheral part forms what? Parasympathetic nervous system. So thoracolumbar outflow forms the sympathetic nervous system, while the peripheral part, that is craniosacral outflow, forms the parasympathetic nervous system. So this is our central nervous system. This is what? Central nervous system. It includes what? Includes under the central nervous system, this is the brain stem, and this is the spinal cord, and this is brain stem. Now my dear friends, as you all know, the third cranial nerve emerges from where? This is the midbrain. This is what? This is midbrain, and from the midbrain, this is the third cranial nerve, and this third cranial nerve is the oculomotor nerve, and this nerve is actually emerging from the Edinger-Westphal nucleus that is present in the midbrain. Now this oculomotor nerve is going and making synapse with the ciliary ganglion. This is the ciliary ganglion, and from the ciliary ganglion, this is coming post-ganglionic parasympathetic nerve fiber. This is the pre-ganglionic parasympathetic nerve fiber, and after the ciliary ganglion, this nerve that is coming out is the post-ganglionic parasympathetic nerve fiber. As this is parasympathetic part of the oculomotor nerve, that is why it causes pupillary constriction and ciliary muscle constriction. So again, third nerve emerging from the midbrain, and from the midbrain which nucleus, Edinger-Westphal nucleus, and this is third cranial nerve, that is oculomotor nerve, that forms the preganglionic parasympathetic nerve fiber, and that forms synapse with the ciliary ganglion. This is the ciliary ganglion, and after the ciliary ganglion there is postganglionic parasympathetic nerve fiber coming out, and this is going to the pupillary muscle and the ciliary muscle. Now after third cranial nerve there is coming seventh cranial nerve, and seventh cranial nerve is the facial nerve, and from the superior salivatory nucleus of the facial nerve, from this superior salivatory nucleus there is coming facial nerve. This is the facial nerve. This is preganglionic parasympathetic nerve fiber that forms the facial nerve. Now the facial nerve is having two parts. One is going towards the pterygopalatine ganglion, or it is also called as the sphenopalatine ganglion. This is what? Pterygopalatine ganglion or sphenopalatine ganglion. And this part of the facial nerve that forms the preganglionic parasympathetic nerve fiber is the greater petrosal nerve, or that is also called as the superficial petrosal nerve, or that is also called as the larger petrosal nerve. So this nerve of the facial nerve is going towards the pterygopalatine ganglion or sphenopalatine ganglion, and the postganglionic parasympathetic nerve fiber coming out from this ganglion, pterygopalatine ganglion, is innervating to the lacrimal glands and the nasal glands. Now this part of the facial nerve, that is going towards the submandibular ganglion is the chorda tympani, and the postganglionic parasympathetic fibers that is coming from the submandibular ganglion, this is what? Submandibular ganglion is innervating to the submaxillary glands, sublingual glands and submandibular glands. So these three salivary glands are under the control of the chorda tympani that forms synapse with the submandibular ganglion. Now coming to inferior salivatory nucleus, and from this inferior salivatory nucleus this is coming what? Ninth cranial nerve, and that is the glossopharyngeal nerve, and the part of this glossopharyngeal nerve is making synapse with the otic ganglion. This is the otic ganglion, and this otic ganglion is responsible for giving nerve fibers, for giving postganglionic parasympathetic fibers to the parotid salivary gland. So superior salivatory nucleus is forming which cranial nerve? Seventh cranial nerve, and inferior is related to the ninth. Inferior salivatory nucleus is related to the ninth cranial nerve, and the superior salivatory nucleus is related to the seventh cranial nerve. Inferior salivatory nucleus, inferior means ninth. Inferior will give ninth cranial nerve, and the superior salivatory nucleus will give seventh cranial nerve. Now from the superior salivatory nucleus there is coming out what? Seventh, that is facial nerve, and this will have two parts. One is greater petrosal nerve, and second one is the chorda tympani. Greater petrosal nerve will give branch to the lacrimal glands and nasal glands, while the chorda tympani will give submaxillary glands, submandibular glands and sublingual salivary glands. Now the remaining one is the parotid gland, and that is under the control of which cranial nerve, ninth cranial nerve, and that is coming out from the inferior salivatory nucleus. Now the vagus nerve that is coming out from the dorsal motor nucleus of the vagus and the nucleus ambiguous, and this together, the nerve fibers that are coming out from the dorsal motor nucleus of the vagus and the nucleus ambiguous forms the vagus nerve, and this vagus nerve is very large, nerve that is innervating to the heart, lungs, stomach, small intestine and the colon. Now here one very important point is that all the nuclei of the cranial nerves are located in the central nervous system, that is in the brainstem, and the length, second is length of the preganglionic, these are the preganglionic parasympathetic nerve fibers. The length of the preganglionic parasympathetic nerve fiber is longer than the length of the postganglionic parasympathetic nerve fiber, while in the sympathetic nervous system it is reverse. The preganglionic nerve fibers are shorter than the postganglionic sympathetic nerve fiber. Length of these fibers, these preganglionic sympathetic nerve fiber is less than the postganglionic sympathetic nerve fiber. So in the parasympathetic nerve fiber, length of preganglionic parasympathetic nerve fiber is longer than the postganglionic parasympathetic nerve fiber, while it is reverse in the sympathetic nervous system, and in the sympathetic nervous system the length of the preganglionic sympathetic nerve fiber is less than the postganglionic sympathetic nerve fiber. So these 2 points are very important. One point is that all the nuclei of the cranial nerve and sacral nerves are located in the central nervous system, and the length of the preganglionic parasympathetic nerve fiber in the parasympathetic nervous system is longer than the postganglionic parasympathetic nerve fibers. Here in the parasympathetic nervous system, the ganglia are present very near to the structures or organs that are innervated by the parasympathetic nerve fibers. So these ganglion are present near to these structures that are innervated by the parasympathetic nerve fibers. While for the vagus nerve, all the ganglia are present within the organs or within the structures itself. So these postganglionic parasympathetic nerve fibers are very short as compared to all these postganglionic parasympathetic nerve fibers. So these differences or these important points can be asked in your MCQs in your PG entrance examination. So these are very important points. Now my dear friends, after cranial nerves, here these are the sacral spinal nerves. One is S2, S3 and S4, and that are innervating to the colon, bladder and sex organs. And all these structures are present in the pelvic region. So all these pelvic organs are mostly innervated by these parasympathetic nerve fibers, that is S2, S3 and S4. So these cranial nerves and these sacral nerves that are present on the periphery forms the parasympathetic nervous system, while the thoracolumbar part that is present in the center forms the sympathetic nervous system. So friends, this is all about the nerve fibers that forms the parasympathetic nervous system, and this is very important for your PG entrance examination. Friends, I hope this video will be very helpful in understanding the nerve fibers which forms the parasympathetic nervous system, and if you really gain something from this video, then please share this video as much as possible to your needy friends. And in the last, thanks for watching this video, and I wish you all the best for your bright future.